How do false positives affect cancer diagnostic tests? Imagine waiting anxiously for a test result that suggests you might have cancer, only to find out later it was a false alarm. False positives happen when a test shows cancer might be there, but further checks reveal no cancer. For families and caregivers, understanding how false positives impact their loved ones is really important. When a test gives a false positive, it can cause a lot of emotional stress. The person being tested might feel scared, worried, or overwhelmed while waiting for more tests. This anxiety can last days or even weeks, making the whole process very tough. Loved ones often share this stress, trying to stay strong and supportive during this uncertain time. False positives also lead to extra medical procedures. These can include more imaging tests like mammograms or ultrasounds, or even biopsies, where a small tissue sample is taken. These procedures can be uncomfortable or invasive, and sometimes carry risks like infection or bleeding. For caregivers, helping their loved ones prepare for and recover from these procedures adds to their responsibilities. Another effect of false positives is on future screening habits. Someone who gets a false positive might worry about getting tested again. They might hesitate or avoid future screenings because they fear more false alarms and unnecessary procedures. But regular screening is important for catching cancer early and improving treatment success. So, understanding that false positives can happen helps people make informed decisions about ongoing tests. False positives can also have financial consequences. Additional tests and procedures often come with costs that might not be fully covered by insurance. For families managing healthcare expenses, this can add extra stress. It's helpful to know that these costs are part of the screening process and to plan accordingly. From a medical point of view, false positives are a known limitation of many cancer screening tests. For example, in breast cancer screening, many women experience false alarms over time. While these false positives can increase worry, they also sometimes lead to earlier detection of actual cancer. Some research shows women with false positives may have a slightly higher chance of developing breast cancer later, which encourages continued screening. In summary, false positives can cause emotional distress, lead to more medical procedures, create financial strain, and influence future screening choices. Families and caregivers play a key role in supporting loved ones through these challenges. Knowing what to expect helps everyone stay calm and focused on health, even when a test result turns out to be a false alarm.